everybody. So far, apparently it's only me. We're here with Job. My name is Christine Colamonico. I am a veterinarian and the co-founder of Job. And today we're here to talk with Dr. Deb and see what she recommends for your active dog and how to better care for their joints health. So this seems to be... This is the first time doing it, so bear with me. See how that's going to work. Hi, Dr. Deb.
Hi, Dr. Christine. How are you?
Good. How about you?
I'm good, thank you.
I was saying that this is my first time doing this, so, trying to see what was going to happen. I'm glad it worked for you. So I was saying that, so we have 2 people joining, 3 people joining. So I was presenting myself saying I'm a veterinarian. I'm one of the co-founders of Jope, which is a pet nutraceutical company. And today we're very excited to have you, Dr. Deb, to talk about joint health and athletic and active dogs. So you are the owner of Wizard of Paws, which, we are going to want to know how you came up with that name. And we're super thankful to have you join today and share your expertise with us. So do you mind just introducing yourself briefly and, giving kind of, I guess what we would like to know is how did you come to start your own rehabilitation center with a very cool name, Wizard of Paws? So if you could kind of, give us that and how you got mixed into the veterinary rehabilitation world, that would be great.
Yes, absolutely. So I have been doing this longer than I want to admit, but almost about 25 years. And I saw a need. I mean, most animals 25 years ago or even a little bit longer weren't getting all of the treatment that they needed for either arthritis or injuries that a lot of people receive therapy from, for example, like cranial cruciate or ACL sort of problems. So there was this need, and all of these people were receiving rehab, but we kind of forgot about our animals. And so it kind of started slow and then has picked up and hasn't stopped. And the name Wizard of Paws, it's really funny because I'm not a huge Wizard of Oz fan, but just kind of playing with words one night and it just kind of came together. And it's, a name that everyone remembers, and we kind of play with it, follow the yellow brick road. And, depending upon the given day, we could have, who's the good witch, who's the bad witch, kind of thing. The flying monkeys and all of that. Here's a little flying monkey in here.
Aww, so cute.
Little odd. So, and it's
in today.
He's listening. He's trying to throw his 2 cents in also. He's one of the office. And it's been, we see dogs, anything from down dogs that can't walk up to dogs that are very athletic. A lot of conformation dogs or show dogs that may have a really minor gait deviation, or a lot of the working dogs. So, we look at movement and everything that they're doing, and certainly fitting into that multimodal approach of always decreasing pain and inflammation and then improving their strength and function is huge. And protecting their joints is such a big part of that. So,
it sounds like you're quite busy since you started, let's say a few years ago.
Yes.
So we won't go into the details. I also do want to say I had the pleasure of visiting you and your team. I think it was like 2 months ago. And you guys are awesome. Like, it's a beautiful facility. There's a lot going on. So actually one of the questions we'd love to ask is how many patients do you think you see about per day? Because I know when I went there, you had like two underwater treadmill going on. You had somebody assessing in a room, gait, doing gait analysis. So you were busy, and I only stayed like 2 hours.
Yeah, we have a lot going on. We have big enough staff that we probably see anywhere, just depending, 3 to 4 dogs an hour.
Okay.
Uh, and we're there typically of long days, where we work a couple 12-hour
Oh,
days and then a little bit shorter the other days, but it's definitely busy. And I always laugh. My staff probably hates when I'm not on the road, I'm not teaching, and I'm there, because I'm like, well, yeah, sure, we can take a look at this, dog, or let's do a gait analysis, or I kind of mess up their whole schedule. But we do have a lot of toys, I call them, like you had seen, our dynamic gait analysis and our thermal imaging camera, so we could see things going on with the animals, and many toys to treat with. The underwater treadmills are kind of like the wow kind of thing, but certainly with pulse shockwave and laser and all of that, there's always something going on. And then, never mind, I always say your hands are your best piece of equipment that we have, and you're petting the dog or doing something else, so always great.
yeah, no, I saw that, and as you were saying, you have a lot of fun toys, I guess, and they are very impressive. But I do really, relate to the fact that you said, your hands are really kind of your best tools at the end of the day, because you do want to, make sure you're petting the dog and feeding, every single inch of their body, because they don't speak, so they can't necessarily tell you what's going on, right? Um, so you're very busy, and today we'd love to ask you so many questions, but I think one of the main focus was really about how to, if you have a younger, maybe more active dog, not senior and later in life where they're kind of slowing down, how do you keep them really active, whether they're athlete dog performing in maybe a competition, or doing some sports, but even like you said, show dogs, or just, a pet parent that has an active dog that's playing around in the dog park or going on hikes. Like, you probably see a lot of these patients, and I guess we can start kind of whichever way you think is going to be more beneficial to our pet parents. But, how do they ensure they're going to stay active, and why would you sometimes see a dog that's very active in your rehabilitation center? Is it more proactive, or is it because they have identified a problem and you're kind of here to help them deal with it?
Yeah, really great questions. And I think it's probably a combination of both. So we definitely see, like a lot of our working dogs, a lot of our show dogs, we're seeing proactively. So with the goal of preventing issues. And we always want to keep them in good shape. Like, just like anyone that's listening, we may work out, not only for our mental well-being, but also our physical well-being. So it's always important to keep in good shape, keep in good weight. No matter what, we all may have to start taking vitamins or joint supplements at some point. Eating properly is such a big, key component, and the animals feeling well and staying well. But still, things will happen. And there's certainly measures that pet owners could take. The first thing I always tell pet owners, if you suspect something is wrong with your dog, definitely get it checked out, because your animal 99.9% better than anyone else. And even if you think you see something, like, I'm thrilled when owners bring their animals in and say, I think, maybe it's nothing, but I would much rather get a baseline, and we know how they're doing and how they're feeling, and then we can go from there. You know, Dogs do stupid things. I mean, they're crazy, I watch my own two dogs, and they can do crazy things. Sometimes we have to intervene and say, okay, slow down a little bit. There are things that we can definitely do to prevent issues. And my big, huge one is playing ball or playing fetch.
Mm-hmm.
So owners love to do this and think it's such a great activity to burn energy or, throw it in as part of their walk. But it's actually can be very detrimental. And I see more injuries probably from ball playing or fetch or frisbee throwing than a lot of your organized sports. And again, I think most of the time the dogs aren't warmed up. They're not in a good weight. They're kind of letting their excitement take over, and they run, and it's the stopping motion that puts so much stress on their body.
Mm-hmm.
That can lead to soft tissue injuries or ACL or knee injuries and all of that sort of stuff. So important to, like, I always tell owners, like, think before throwing. Like, that's huge, kind of always talking about that.
So that's actually a very good Dr. Deb. It's a great it's kind of a great coincidence because we just had a question about what is one of the activities that can lead to acute injury, and so I think you
Yes.
kind of answered.
Yes. Definitely. So often, issues with that. So definitely.
What is a good way? So one of the follow-up question was, what way do you recommend, if you're a pet owner and your dog is very active and wants to play ball, as you said, sometimes, they love it, and like it's also a good way to get exercise if you don't have, like miles to hike.
Yeah.
How could you warm them up to kind of try to minimize? And if you warm them up, do you think that's a kind of a good prevention for any injury linked to ball throwing?
Yeah, and I think definitely a warm up helps. So we always want to stack the cards in our dog's favor or try to do whatever we can to prevent. So, I mean, we think about the activities that we're going to do, and, if we're going to go on a hike or we're going to go, play ball or anything like that, I would suggest starting with a slower walk. I always, joke and call it the elimination walk. So let them go to the bathroom, let them kind of get it all out of their system. And then a 5-minute faster paced walk, maybe a trot, so you're starting to get the blood flow going and, just start to get them ready for, movement. And then you can get into it. But on the other end too, we want to make sure that we cool them down as well. Like, it's during the summer, it's so warm out. We want to make sure that we bring their blood flow down, and we're doing everything that we can to get their heart rate back to normal. So a cool down is just as important as that warm up. And we want to make sure that we're doing that with them.
What about if you're limited in time with like a massage or something, would that help, like massaging the muscles, making sure you're maybe taking their paws and like, I'm doing a great demo right now.
Yes. Definitely. So, if you're like stuck for time or like space, if you're living in a city and you don't have, you can kind of get creative and at least get the blood flow going a little bit. Like, so for example, don't take the elevator, take the stairs, up and down, and that helps. Certainly doing some massage is great. Some soft, what's called effleurage, and starting to get some blood flow going is perfect. Anything better than nothing. If you think about how we feel, like, I know my alarm goes off and I jump up and my heart rate is like pounding, and that's kind of stressful. And, I watch my dogs get up and they kind of stretch and, do their own thing. They're much smarter than we are, I always say, like, we're the dummies that always, kind of do all of that stuff. But, anything is better. And, certainly watching, what you're walking on, like the surface. For those owners that live in the city, always walking on the street is very concussive to the joints. So you want to be careful with that. And the same thing with something that's too soft, like sand. And that may be, some dogs may not have the stability needed for that. So.
Okay, so it sounds like if you want to play kind of a more intense activity with your dog, you really want to think about warming up and then cooling down after. You also want to be mindful. I'm trying to recap everything. You're trying to be mindful of the surface, right? Like not too hard, not too soft. You said proper nutrition, joint supplements for active dogs. How early do you want to start like thinking about all this? Like so you said nutrition, supplements, activity, weight management. When should we start thinking about all this?
So I like to start thinking about it right from the start. As soon as you get that puppy or you get your dog, if you're going out there and getting a rescue, that's fantastic. As soon as you have your little paws on them, to start thinking. So puppies may not need joint supplements right away, but we want to start thinking about good nutrition. And we want to start thinking about proper exercise and keeping them at a good weight. And depending upon the breed, I usually like to get dogs started on joint supplements anywhere from 6 to 9 months of age.
Okay.
Some of the larger breeds, like we know that anything that we can do to prevent inflammation in their joints is going to be proactive. So, looking at that and making sure we know that we're doing, again, everything that we can to protect those joints, protect that body. It's inevitable. Everyone is going to get osteoarthritis, and but what can we do to definitely help and protect with that? So.
And I think it's like, I love that you said, you start them as early as 6 months to 9 months of age, depending on the weight and the breed. That is a question, that I get often. So again, I'm a, veterinarian who co-founded Jope, which is a pet nutraceutical company. And what a lot of people don't necessarily realize is I started that because I think I told you, Dr. Deb, I had a dog, Pepsi, who was very active. He was like a shepherd French dog, and we would go running. I probably didn't stretch him and warm him up the way we were supposed to. So now, in retrospect, I'm like, listen, learn. But he developed, like you said, osteoarthritis later in his life, around 9 years of age. And I think looking back, after reading about everything and now having this company because of my learnings with Pepsi, is realizing that I could have done something sooner. And I think that's, somewhat hard for me to realize, like, because I'm like, have regrets in a way. But that's also the reason I'm creating Jope, is because I want to help raise awareness. And when people ask me, like, oh, I have a healthy pup, should I start them now? Like, they're young, they're maybe one. My answer is always yes. And it really is something I, strongly believe in, is like joints, you can't repair them once they're damaged. And like you said, we're most likely all going to have osteoarthritis at some point. But what we want is like delay the moment this is going to happen. And we want to prevent this progression from being too fast. And so that's why, and like you said, it's not just supplements, it's also diet, exercise. So if you do all that early, you're kind of setting yourself up for a great senior year, right? Or senior years.
That's all, where if we can do whatever we can to prevent that pain and inflammation, we all, us, the dogs, the animals, just stay stronger and just have a much better, quality of life. And that's what we want. And trust me, I have those dogs in my history too, that I feel bad about, that I didn't warm up, or, I let them do this, and you think about it, and, hindsight's always 2020. And,
Yeah.
that and I are out there doing so much and helping other other animals. So
And I do thank you. I wish I had met you, you know, like 10 years sooner. But when we met, we could immediately feel your passion and, you know, visiting your team and seeing how much you care and, you know every one of your patient. It is very, you know, awesome to see you guys work together. So, um, and we have a question too, actually, I think from one of your fans, Dr. Deb, regarding puppies. And it is, you know, somewhat, I guess, not necessarily super active dogs or athletic dogs, but puppies, it is a great question. Some people might have a tendency to, you know, want to, like, basically not have a tendency, but people don't always know how much exercise is appropriate for a puppy, right? And like also, should we let them jump on the couch? Should we let them jump on the stairs, go up and down? So, you know, what are your quick, you know, do's and don'ts about puppy activity, and how often should they be walked, or appropriate exercise, if you have, you know, a few recommendations?
yeah, definitely, because it's something I definitely see people walking puppies too much and overdoing it. And it may not affect them right away, but it will down the road. And really, we always want to look at when their growth plates are
Mm-hmm.
closed, and we don't do that unless x-rays or radiographs are taken. But I always tell owners those growth plates are like little machines in the bones, and they're working to continue to allow the dog to grow in a healthy manner. And if they're damaged from too much jumping or too much running early on, they can have effects that will last their lifetime. So we don't want to overdo it with them. And I always say, let puppies be puppies. You know, and sometimes it's hard. There's certain breeds that are psycho crazy, you know, other breeds are more quiet. But, you know, if you look at definitely letting them rest when they want to. I mean, that's the first thing. We always want to, if they're tired, you know, let them rest. And certain breeds are going to fatigue quicker than others. Our like large breed Newfoundland puppies are probably going to sleep more and almost look like, you know, they grow while they sleep. And other active dogs are going to want to go more and more. And so many owners then want to take them for long walks and tire them out. And that's, you know, not a great plan. And really, like, not, you know, I will tell owners to follow the 5 minute a month rule.
Okay.
So 2 months old, don't do more than 10 minutes of a walking activity. And the difference being, if they're running outside and playing, most of the puppies will stop when they're tired. But when they're on a leash, we're really, I don't want to say forcing, but we're really encouraging them to keep going. So different. If they're playing outside, we'll count that as one thing. But the walking, I really like to stick to only 5 minutes per month of life. So a 6-month-old puppy may be able to do 30 minutes throughout the day. So maybe 15 and 15. And again, that's kind of a general rule that will depend upon the size of the puppy, how active they are, if they're jumping all over the place. There's so many ways to tire a puppy out. And I love mental enrichment instead of, you know, running and all of that sort of stuff. And definitely looking at jumping down can be so bad, especially for so many of those bully breeds, like the bulldogs, the bull terriers, and, you know, just your stockier breeds. And I mean, your bigger breeds too, there's so much stress on the elbows and the wrists and the shoulders. And, you know, actually, while I'm thinking about it, they may be lighter, but even my little Brussels that went by here, you know, him jumping off the couch, it's like you and I jumping off the first floor story, you know, building, kind of jumping. It puts a lot of stress on the joints. So we really want to be careful with that too. So I know it's all, I see, especially Labrador retrievers involved in field trial, and they may have been exercise at 6 months of age and run for miles and miles. And by the age of 4 or 5, there are already changes that have occurred in their feet and the arthritic changes and all that sort of stuff because it's just been too much too soon.
That sounds very heartbreaking. It's not doesn't paint a very pretty picture of these poor puppies.
I know,
But
so
I
true.
think your advice is great, and I actually hadn't heard about the 5 minute month rule, but I think it's definitely a great one. And I do like also listening to your dog. I think that's true for any age. Not like forcing them to be active because they're probably telling you something too, right? Like, if your dog doesn't want to go out and usually they love it, that might be a sign that maybe you should get them checked or have something, looked at. So back to the more athletic dogs, what is what are the more common injuries you see when you have like a athletic or highly active dog that comes in? Like maybe top 3 injuries you see in your practice?
Yeah. So of the pretty athletic dogs, we'll definitely see soft tissue injuries,
Mm-hmm.
like an iliopsoas strain or a bicipital tenosynovitis in the shoulder. That's both are very common. Cranial cruciate or ACL injuries are another one that is fairly, definitely fairly common. Um, and then we may see other athletic dogs like back pain from doing crazy things like jumping off the couch or, everyone has Frenchies right now. And, it's like not only are they the most popular dog in the United States, like they're becoming one of the more popular dogs in rehab, in emergency clinics, orthopedic and neurological clinics as well. So,
They have a lot of back issues, right?
yeah, definitely a lot of spinal issues. And I think right now we have like 6 or 7 active Frenchies in our clinic with spinal disease of all varying degrees. So, yeah.
So when you see these, injured patients, do you have kind of I guess a treatment plan that is not standard because obviously you're adapting every treatment plan to your patient, but kind of a framework
Mhm.
that you utilize that you find has been helpful? And could you just share a little bit, maybe the duration, at home care, what you do in the practice, like things of the sort, to get them back to where they were? And is it possible to get back to where you were?
Yeah. And that's, I'll answer that first. Always the goal is to get them, back to what they were doing or whatever is normal for them, if we can. But so we always set that as our goal, and then we're realistic about it. And I would say that probably 95% of the animals, if they're starting off, fairly well, they're back. We're getting them back to normal. But the first thing is always to establish and find out what's wrong. So commonly, there may be a primary problem and then a secondary and tertiary. So for example, like you or I may wear heels to a wedding and get a blister, and our foot hurts, but then our back hurts because we're wearing heels, and then our legs hurt. So often if a dog has an injury, they start to compensate and then they're doing something else somewhere else. So we want to determine where the primary problem is, the secondary, the tertiary. And then we look at the goal of reducing pain and inflammation. And there's so many ways that we could do that, from hands-on approaches to modalities such as laser, photobiomodulation, shockwave, ice. I always say like ice is one of the best anti-inflammatories. Sometimes heat. So there are a variety of things that we could do. And then we'll look at, we have that, and maybe initially we're doing more of what needs to decrease that pain and inflammation, and then we're gaining their strength back and gaining that range of motion. So anytime there's pain and inflammation, we're going to have some atrophy or weakness. So we want to work on that. And, we may start off, slow and then start building up and get them closer to their goals. So for example, if the dog is having trouble just walking a couple minutes with their owner, we want to start building them up, make sure their core strength is there, and then the strength of their legs and all of that. And then we start building endurance. And so we do things in the clinic, and like you saw, the underwater treadmill it's great to work on strength and endurance, and that helps the dog just move better on land, because we have a reduction in stress on the joints and all of that sort of stuff. And it always depends how long the problem has been going on. And then, we look at the return, to function. But we definitely, want to get everyone back to their highest level of function. That's always the goal.
I know, and I'm sure people are very thankful when they come to you and, you're able to do it. Does it, what is kind of the shortest time frame sometime you're able to bring the dog back to where they were before, and then the longest, time frame? Obviously some might be chronic, and like if you have a tear, but what's the kind of an average for the longest and shortest?
We have maybe like 2 treatments. We can get them back to normal. Some of the, especially the very high level, once I try going on.
Dr. Deb, I don't know if it's your sound or my sound, but I'm not hearing you anymore.
Can you hear me now?
Yes. Perfect.
So I was going to say that the quickest has probably been just 2. Okay. If we can identify what's going on. And then certainly we have animals that we do see, they have more chronic conditions, and maybe we're not seeing them as frequently, but maybe once a month, and then we're fine-tuning things and changing what they're doing at home. So, it really depends upon the animal and, what everyone's able to do at home as well.
Okay. So I guess if possible, try to be very observant, do everything you said proactively. So like, proper nutrition, weight management, supplements, activities, but adapted to your dog's capability and not trying to push them, more than they can do. I'm actually curious to ask, in the study we're doing with your team and Jope, do we have any athletic dogs that are on Jope, or?
We have 2 athletic dogs in our study. Okay. So.
Hey. What happened to them, just briefly? Are they okay or chronic?
So one had a soft tissue injury, an iliopsoas injury, and then the other one sprained their wrist or their carpus. Okay. And I think the one that sprained its carpus did it just out in the backyard, chasing squirrels or something like that. So yeah.
A burst of activity.
Exactly, yes.
So I'd love to also ask, obviously I'm very interested, and one of the reasons we came to meet was, we wanted your expertise in supplements. And so, thank you very much for supporting us. And obviously we're not the only supplement you recommend. So what are your kind of, highlights for pet owners who are looking to support the joints? But, there is a lot of product out there on the market. What are your kind of main guidance and key points they should remember?
Yeah. So I think, there are plenty of products out there, and I always say you want a good product. So many of our clients are looking for all natural, organic. They want to read the supplements, or read the ingredients in the supplement, I should say. And it's part of the reason that Jope has been such a hit with our clientele, because they could see what's in it. They may not immediately understand what UC2 is, but they're knowledgeable. they're looking it up, and they're very grateful, and I'm very grateful that it is organic and all natural, and they know what they're putting into their pet. It has been fantastic, with everything, because so many of our clients are feeding a natural diet, not necessarily raw, it could be cooked, but they're looking for more organic ingredients, and so Jope fits right in. And again, looking at prevention, because the main dream going through all of the clientele is that they want their animals to have the best quality of life. And I always say that that is something that we want to look at, the best quality of life for the longest time possible. So anything that they could add onto their life, would be great. So
I think you're making a great point. It's like, obviously, and thank you for, a very beautiful review of Job, which means a lot, because I spent, months thinking about it, and it comes from my personal experience. But I think when people ask me, I always say, just know what you're giving. And I think that's true for food or supplements or anything. Like, know what you're taking yourself,
right.
and then know what you're giving to your pup, and just look it up. As long as you're comfortable with what you're using, I think that's what's really important.
Yeah.
And somebody had a question for us. What would be a good supplement to give dogs for luxating patella? So luxating patella is when you have basically a little bone, right, that moves, and that constant friction can create arthritis later in life, right? The repetition.
Yeah. So definitely, I mean, Jope would be perfect because you want to, help prevent. I mean, it's inevitable that that dog will have arthritis because of the instability in the movement. I mean, looking again at that multimodal approach and trying to strengthen up the quadriceps and the rest of the leg, to prevent too much movement there. Sometimes you can't completely prevent all of the movement without a surgical intervention, but you can certainly do a lot, conservatively. So I would definitely recommend that, and keep them on to assist with it.
Yeah, I think that's, trying to, I guess you're saying trying to gain as much as possible some muscle stability, right? And then adding a supplement. So with Jope, when you're mentioning, type 2 collagen on denatured, it does help decrease inflammation at the joint level through oral tolerance. I know that's, what we chatted about, Dr. Deb, and then it also helps repair cartilage damage that can happen. So is the reason we decided to use this ingredient, and, we're very happy to see some very positive results. So, that is a great kind of how do you say that, case study, use case, to try it.
Yeah.
So if somebody wants to try it, you can just message us, and we're happy to answer questions. And I know, Dr. Deb, you're always available to help people too. So did you have any questions for us? I appreciate you joining us after a long day of helping over 50 dogs potentially. I know you traveled
Yeah.
all last week too, right?
Yes, yeah. Teaching a rehab program. So the CCAT program down at NC State Vet School. So it was really down there. But no, I'm excited to the study that we're working on. I'm very excited about that, and looking at the results so far have been promising. And, it's just, I love what I do. So it's, easy to not get exhausted.
I am very, very impressed. I think since we've met, you've been on the road, like half of the time, and otherwise you're just working.
Yeah.
So it's been a pleasure working with you. Thanks again for joining us tonight. I've been, kind of how do you say that? Referring, I guess, some people to you, and I know the feedback has been amazing. So, thank you for helping all these dogs. And if
And you're doing so much as well. So that's incredible. Thank you.
we try, puppies and dogs in general, they mean so much to us that, more and more we're just we want to help and be part of the movement to keep them happy and healthy. So I think, that's why we get along so well anyway.
Yeah.
So I think if anybody has any questions, you can just DM us directly. And, if you have access to my Instagram, or I guess yours too, right?
Yeah, absolutely.
It's Wizard of Paws. Your Instagram is Wizard of Paws.
Yeah, Wizard.of.paws.
And
so
I'll post it in the comments too. I'll post this video, so I'll add your contact information and ours.
Perfect.
But thank you everybody who joined. Thanks again, Dr. Deb. It was awesome.
Thank you. Have a great night.
Thank you.
Bye.
Bye. Okay, so
Got it.
I need to turn off now.
Bye.
Bye. How does this work?